Hello everyone, I am your host Yshak. Welcome back to part 2. So today we'll be discussing electrotherapy modality, starting from intermittent compression and edema management, then to ultrasound, then to hydrotherapy, IFT, TENS, shockwave, laser, evidence-based practices, electrical muscle stimulation, paraffin bath, Russian stimulation, UVR, and in the next part of the video, we'll be doing clinical application. I'm not wasting our time. Let's start with the first topic. Intermittent compression and edema management. These two in the carefully crafted questions will test your understanding of edema pathophysiology and classification, lymphatic system function, intermittent compression parameters and protocols, indications and contraindication, clinical application and safety consideration. Before we begin, make sure you grab a pen and paper, attempt each question yourself, then check your answer with detailed explanation. Question number 1. Which of the following best defines edema? Option A. Accumulation of excessive fluid in the intercellular space. Option B. Presence of abnormal excessive amount of fluid in extracellular space. Option C. Accumulation of blood in arteries. Option D. Excessive protein loss in urine. And the answer is Option B. Presence of abnormal excessive amount of fluid in extracellular space. Now let's move to question number 2. What is the main function of lymphatic system in edema management? Option A. To produce red blood cells. Option B. To collect the return and excess extracellular fluid and plasma protein to venous system. Option C. To regulate blood pressure. Option D. To synthesize hormones. And the answer is Option B. To collect and return excess extracellular fluid and plasma protein to venous system. Now let's move to question number 3. Which of the following is a characteristic of pitting edema? Option A. No pit is formed on pressure. Option B. Pit disappears immediately after pressure is released. Option C. Pit remains for long time after pressure is released. Option D. Only occurs in presence of infection. And the answer is Option C. Pit remains for long time after pressure is released. Now let's move to question number 4. Which of the following is not a method of edema management described in the PDF? We'll be attaching the PDF in the Telegram channel. Now let's move to option A. Rest, ice, compression, elevation. Option B. Application of intermittent compression device. Option C. Use of diuretics as first line of therapy. Option D. Muscle contraction, exercise. And answer is Option C. Use of diuretics as first line of therapy. Now let's move to question number 5. What is the recommended pressure for intermittent compression device in edema management? Option A. 10 to 20 mmHg. Option B. 70 to 80 mmHg. Option C. 50 to 60 mmHg. Option D. 30 to 40 mmHg. And the answer is Option D. 30 to 40 mmHg. Now let's move to question number 6. Which of the following is a contraindication for intermittent compression therapy? Option A. Lymphedema. Option B. Deep vein thrombosis. Option C. Traumatic edema. Option D. Chronic edema due to inactivity. And the answer is Option B. Deep vein thrombosis. Now let's move to question number 7. Which method is most effective for preventing edema formation after acute injury? Option A. Only rest. Option B. Heat application. Option C. Immediate pain bearing. Option D. Rise approach. Rest, ice, compression, elevation. And the answer is Option B. Rise approach. Now let's move to question number 8. Which of the following mechanism does not help move lymph through the lymphatic system? Option A. Skeletal muscle contraction. Option B. respiration. Option C. Elevation above the heart level. Option D. Direct nerve stimulation. And the answer is Option D. Direct nerve stimulation. Now let's move to question number 9. What is the typical on-off time sequence for intermittent compression device? Option A. 1 minute on, 4 minute off. Option B. 4 minute on, 1 minute off. Option C. 10 minute on, 10 minute off. Option D. 1 minute on, 1 minute off. And the answer is Option B. 4 minute on, 1 minute off. Now let's move to question number 10. Which of the following is not an effect of prolonged edema? Option A. Pain. Option B. Increased joint range of motion. Option C, delayed healing. Option D, invalid function. And the answer is option B, increased joint range of motion. Now let's move to question number 11. Which of the following is key characteristic of non-pitting edema? Option A deep pit forms and remains for a long time after pressure. Option B, it's primarily caused by increase in venous pressure. Option C, the edema is soft and easily displaced. Option D, no significant pit is formed when the pressure is applied to the skin. And the answer is option D, no significant pit is formed when the pressure is applied to the skin. Now let's move to question number 12. Which of the following is not an indication for intermittent compression? Option A, lymphedema. Option B, traumatic edema. Option C, severe cardiovascular problem. Option D, chronic edema secondary to inactivity. And the answer is option C, severe cardiovascular problem. Now let's move to question number 30. What is the main mechanism by which compression reduces edema? Option A, decrease in lymphatic flow. Option B, increase in extracellular pressure, pushing plasma and protein into lymphatic capillaries. Option C, increases blood viscosity. Option D, reduce plasma protein concentration. And the answer is option B, increases extracellular pressure, pushing plasma and protein into lymphatic capillaries. Now let's move to question number 14. What is the typical duration for single intermittent compression section? Option A, 1 to 5 minutes. Option B, 10 to 30 minutes. Option C, 1 to 2 hours. Option D, over 5 hours. And the answer is option B, 10 to 30 minutes. Now let's move to question number 15. Which of the following is not a contraindication for intermittent compression? Option A, fracture. Option B, local infection. Option C, renal insufficiency. Option D, mild lymphedema. And the answer is option D, mild lymphedema. Now let's move to question number 16. Which of the following is a sign that lymphatic capillaries are over-distended? Option A, increased lymphatic flow. Option B, stoppage of lymph flow and accumulation of excessive fluid. Option C, rapid dissolution of edema. Option D, decreased osmotic pressure in tissues. And the answer is option B, stoppage of lymph flow and accumulation of excessive fluids. Now let's move to question number 70. Which of the following is a method of compression used in edema management? Option A, lymphatic massage. Option B, use of diuretics. Option C, only rest. Option D, heat packs. And the answer is option A, lymphatic massage. Now let's move to question number 18. Which of the following is not a way lymph is moved through lymphatic system? Option A, skeletal muscle contraction. Option B, respiration. Option C, elevation. Option D, passive diffusion. And the answer is option D, passive diffusion. Now let's move to question number 19. Which of the following is a complication of long-standing edema? Option A, improved healing. Option B, pain and decreased range of motion. Option C, increased muscle strength. Option D, enhanced lymphatic drainage. And the answer is option B, pain and decreased range of motion. Now let's move to question number 20. Which of the following statement about intermittent compression is false? Option A, it is indicated for lymphedema. Option B, it should never reach systolic blood pressure. Option C, it is contraindicated in fractures. Option D, it is recommended for acute deep vein thrombosis. And the answer is option D, it is recommended for acute deep vein thrombosis. Ultrasound. Thermal versus non-thermal effect. Next one is the ERA calculation. Treatment area less than or equal to 2 to 3x ERA. Next one is duty cycle 100% continuous versus 20 to 50% pulse. Cavitation mechanism and the absolute contraindications like pacemakers and acute infection. This makes up to 85% of ultrasound questions. So let's move to question number 1. What is the frequency range of therapeutic ultrasound commonly used in physiotherapy? Option A, 0.75 to 3 MHz. Option B, 10 to 20 kHz. Option C, 20 to 40 MHz. Option D, 100 to 200 Hz. And the answer is option A, 0.75 to 3 MHz. Now let's move to question number 2. Which tissue absorbs most ultrasound energy during therapy? Option A, fat. Option B, muscle. Option C, collagen-rich tissues. Option D, skin. And the answer is option C, collagen-rich tissue. Now let's move to question number 3. What is the main physiological effect of continuous ultrasound application? Option A, non-thermal cell stimulation. Option B, deep tissue heating. Option C, surface cooling. Option D, nerve conduction block. And the answer is option B, deep tissue heating. Now let's move to question number 4. Which of the following best describe the mechanism of ultrasound waves transmission in soft tissues? Option A, transverse wave. Option B, longitudinal wave. Option C, electromagnetic wave. Option D, standing waves only. And the answer is option B, longitudinal waves. Now let's move to question number 5. Which coupling media is most suitable for ultrasound therapy? Option A, air. Option B, dry towel. Option C, gel. Option D, plastic sheet. And the answer is option C, gel. Now let's move to question number 6. What is the main non-thermal effect of ultrasound therapy? Option A, deep tissue heating. Option B, increased blood viscosity. Option C, surface cooling. Option D, cavitation and acoustic streaming. And the answer is option D, cavitation and acoustic streaming. Now let's move to question number 7. Which of the following is a contraindication for ultrasound therapy? Option A, open infected wound. Option B, chronic pain. Option C, muscle spasm. Option D, joint stiffness. And the answer is option A, open infected wound. Now let's move to question number 8. What is the recommended intensity range for therapeutic ultrasound in most musculoskeletal conditions? Option A, 0.1 to 0.5 watts per centimeter square. Option B, 0.5 to 2. Option C, 2.5 to 5. Option D, 5 to 10 watts per centimeter square. And the answer is option B, 0.5 to 2 watts per centimeter square. Now let's move to question number 9. Which phenomena describe the formation and oscillation of gas bubble in tissue during ultrasound application? Option A, reflection. Option B, cavitation. Option C, refraction. Option D, absorption. And the answer is option B, cavitation. Now let's move to question number 10. Which is the penetration depth of 1 MHz ultrasound in soft tissue? Option A, 0.5 to 1 cm. Option B, 1 to 2 cm. Option C, 2 to 5 cm. Option D, 6 to 10 cm. And the answer is option C, 2 to 5 cm. Now let's move to question number 11. Which of the following is not an indication for ultrasound therapy? Option A, tendinitis. Option B, osteoarthritis. Option C, over pacemaker. Option D, muscle spasm. And the answer is option C, over pacemaker. Now let's move to question number 12. What is the main advantage of pulsed ultrasound over continuous ultrasound? Option A, greater heating. Option B, reduced thermal effect allowing use in acute condition. Option C, only used for bone fracture. Option D, causes tissue dehydration. And the answer is option B, reduced thermal effect allowing use in acute conditions. Now let's move to question number 13. Which of the following is the correct safety precaution during ultrasound therapy? Option A, apply over open wound. Option B, use without coupling medium. Option C, keep the transducer moving during the application. Option D, apply over the metal implants. And the answer is option C, keep the transducer moving during the application. Now let's move to question number 14. Which effect is produced by acoustic microstreaming during the ultrasound therapy? Option A, decrease cell membrane permeability. Option B, nerve conduction block. Option C, muscle atrophy. Option D, increased cell metabolism and protein synthesis. And the answer is option D, increased cell metabolism and protein synthesis. Now let's move to question number 15. What is Iontophoresis? Option A, use of electrical current to deliver drugs. Option B, use of ultrasound waves to enhance the transdermal drug delivery. Option C, use of infrared radiation for pain relief. Option D, use of cold pack for inflammation. And the answer is option B, use of ultrasound waves to enhance transdermal drug delivery. Now let's move to question number 16. Which drug is commonly used in Iontophoresis for its anti-inflammatory effect? Option A, paracetamol. Option B, hydrocortisone. Option C, aspirin. Option D, lignocaine. And the answer is option B, hydrocortisone. Now let's move to question number 17. Which of the following is not a benefit of Iontophoresis compared to oral drug administration? Option A, higher local drug concentration. Option B, avoidance of gastrointestinal side effects. Option C, systemic drug delivery. Option D, non-invasive and painless application. And the answer is option C, systemic drug delivery. Now let's move to question number 18. Which tissue interference poses the highest risk for ultrasound reflection and potential tissue damage? Option A, muscle-bone interface. Option B, muscle-fat interface. Option C, skin-air interface. Option D, fat-skin interface. And the answer is option A, muscle-bone interface. Now let's move to question number 19. Which of the following is a sign of excessive ultrasound intensity during therapy? Option A, mild warmth. Option B, tingling sensation. Option C, sharp pain or burning. Option D, slight redness. And the answer is option C, sharp pain or burning. Now let's move to question number 20. Which is a contraindication for Iontophoresis? Option A, chronic inflammation. Option B, intact skin. Option C, open wound. Option D, localized pain. And the answer is option C, open wound. Now let's start with the learning tape. Beat frequency, low 1 to 10 Hz pain gate, high 80 to 150 Hz muscle stimulation. Quadrant electrode placement, carrier versus beat frequency distinction, and the contraindication pregnancy, pacemakers, malignancy. This makes up 85% of IFT questions across all exams. So let's move to question number 1. What is the primary mechanism by which interferential therapy achieves deep tissue stimulation? Option A, direct current application. Option B, superficial high frequency stimulation. Option C, interference of two medium frequency current within tissues. Option D, application of pulsed ultrasound. And the answer is option C, interference of two medium frequency current within the tissues. Now let's move to question number 2. Which frequency range is typically used for the base currents in IFT? Option A, 1 to 10 Hz. Option B, 50 to 150. Option C, 1000 to 5000. Option D, 10,000 to 20,000 Hz. And the answer is option C, 1000 to 5000 Hz. Now let's move to question number 3. What is the main therapeutic effect of low frequency beat produced in IFT? Option A, muscle atrophy. Option B, deep tissue pain relief and muscle stimulation. Option C, increased local fat breakdown. Option D, bone healing. And the answer is option B, deep tissue pain relief and muscle stimulation. Now let's move to question number 4. Which electrode placement pattern is most commonly used for treating large joint with IFT? Option A, monopolar. Option B, bipolar. Option C, tripolar. Option D, quadripolar. And the answer is option D, quadripolar. Now let's move to question number 5. What is the main advantage of using medium frequency current in IFT compared to low frequency currents? Option A, greater the skin irritation. Option B, reduced skin impedance and deeper penetration. Option C, increased risk of burns. Option D, only superficial effect. And the answer is option B, reduced skin impedance and deeper penetration. Now let's move to question number 6. Which of the following is not an indication of IFT? Option A, acute pain. Option B, chronic pain. Option C, open wound. Option D, muscle spasm. And the answer is option C, open wound. Now let's move to question number 7. What is the typical beat frequency used in IFT for pain relief? Option A, 1 to 10 Hz. Option B, 80 to 150 Hz. Option C, 1000 to 4000 Hz. Option D, 5000 to 10,000 Hz. And the answer is option B, 80 to 150 Hz. Now let's move to question number 8. Which of the following is a contraindication for IFT? Option A, over the carotid sinus. Option B, chronic low back pain. Option C, muscle spasm. Option D, postoperative pain. And the answer is option A, over the carotid sinus. Now let's move to question number 9. What is the effect of vector scan mode in IFT? Option A, increases current intensity. Option B, moves the area of maximum stimulation. Option C, reduces patient comfort. Option D, delivers direct current. And the answer is option B, moves the area of maximum stimulation. Now let's move to question number 10. Which parameter is most critical for patient comfort during IFT? Option A, electrode size. Option B, frequency difference. Option C, duration of application. Option D, current intensity. And the answer is option D, current intensity. Now let's move to question number 11. Which of the following is a therapeutic effect of IFT? Option A, increased collagen breakdown. Option B, reduction of pain and edema. Option C, decreased blood flow. Option D, muscle atrophy. And the answer is option B, reduction of pain and edema. Now let's move to question number 12. What is the recommended duration for a standard IFT session? Option A, 1 to 2 minutes. Option B, 5 to 10 minutes. Option C, 15 to 20 minutes. Option D, 1 hour. And the answer is option C, 15 to 20 minutes. Now let's move to question number 13. Which of the following is not a benefit of IFT over TENS? Option A, deeper tissue penetration. Option B, less skin irritation. Option C, greater selectivity for superficial pain. Option D, more comfortable stimulation. And the answer is option C, greater selectivity for superficial pain. Now let's move to question number 14. Which current arrangement is used in bipolar IFT application? Option A, 2 currents for 4 electrode. Option B, 1 current for 2 electrode. Option C, 2 current for 2 electrode. Option D, 3 current for 6 electrode. And the answer is option B, 1 current for 2 electrode. Now let's move to question number 15. Which of the following is a precaution when using IFT? Option A, use over metal implants. Option B, use over areas of impaired sensation. Option C, use in patients with pacemakers. Option D, use over the intact skin. And the answer is option B, use over areas of impaired sensation. Now let's move to question number 16. What is the main purpose of using pre-modulated IFT? Option A, to treat only superficial tissues. Option B, to use more than 4 electrode. Option C, to increase the skin irritation. Option D, to deliver beat frequency modulation within the device. And answer is option D, to deliver beat frequency modulation within the device. Now let's move to question number 17. Which of the following is not a common indication for IFT? Option A, acute fracture. Option B, muscle re-education. Option C, pain relief. Option D, reducing edema. And the answer is option A, acute fracture. Now let's move to question number 18. What is the main safety precaution before starting IFT? Option A, increase current to maximum. Option B, remove all metal jewelry from the treatment area. Option C, apply over open wound. Option D, use only 2 electrode. And the answer is option B, removal of all metal jewelry from the treatment area. Now let's move to question number 19. Which patient group should avoid IFT over the trunk? Option A, elderly. Option B, pregnant woman. Option C, children. Option D, athletes. And the answer is option B, pregnant woman. Now let's move to question number 20. Which of the following is a sign of excessive IFT intensity? Option A, mild tingling. Option B, comfortable warmth. Option C, sharp pain over the muscle twitching. Option D, slight redness. And the answer is option C, sharp pain or muscle twitching. So let's start with the learning tip. Whirlpool bath versus Habak tank indications temperature, buoyancy effect 60 to 90% weight reduction, contraindications acute inflammation open wounds, clinical application subacute arthritis edema reduction. These questions repeat 80% of the time in exams. So let's move to question number 1. Which of the following best describes hydrotherapy in physiotherapy? Option A, use of electrical current for pain relief. Option B, use of water physical properties for therapeutic effect. Option C, application of heat pack. Option D, use of ultrasound waves. And the answer is option B, use of water physical property for therapeutic effect. Now let's move to question number 2. Which property of water is primarily responsible for reducing joint loading during aquatic exercise? Option A, viscosity. Option B, buoyancy. Option C, hydrostatic pressure. Option D, surface tension. And the answer is option B, buoyancy. Now let's move to question number 3. What is the main clinical benefit of water's high specific heat index in hydrotherapy? Option A, rapid cooling of tissues. Option B, enhanced electrical conductivity. Option C, increased resistance to movement. Option D, ability to store and slowly release heat. And the answer is option D, ability to store and slowly release heat. Now let's move to question number 4. In a whirlpool bath, what is the primary function of turbine? Option A, producing water agitation and turbulence. Option B, heating the water. Option C, filtering the impurities. Option D, measuring the water temperature. And the answer is option A, producing water agitation and turbulence. Now let's move to question number 5. Which water temperature range is recommended for treating open wound in a whirlpool bath? Option A, 20 to 25 degrees Celsius. Option B, 26 to 33. Option C, 33 to 35. Option D, 38 to 41 Celsius. And the answer is option C, 33 to 35 degrees Celsius. Now let's move to question number 6. Which of the following is not an indication for hydrotherapy? Option A, sports injury. Option B, osteoarthritis. Option C, open bleeding wound. Option D, edema. And the answer is option C, open bleeding wound. Now let's move to question number 7. How does hydrostatic pressure benefits patients during hydrotherapy? Option A, increases joint loading. Option D, decreases venous return. Option C, increases venous return and circulation. Option D, reduces skin sensitivity. And answer is option C, increases venous return and circulation. Now let's move to question number 8. Which of the following is a complication of prolonged whirlpool bath treatment? Option A, skin thickening. Option B, edema due to dependent limb position. Option C, improved wound healing. Option D, increased muscle strength. And the answer is option B, edema due to dependent limb position. Now let's move to question number 9. Which physical property of water provides resistance to movement during underwater exercises? Option A, buoyancy. Option B, viscosity. Option C, hydrostatic pressure. Option D, surface tension. And the answer is option B, viscosity. Now let's move to question number 10. What is the maximum recommended water temperature for a HAAD tank? Option A, 34 degrees Celsius. Option B, 36 degrees Celsius. Option C, 38 degrees Celsius. Option D, 42 degrees Celsius. And the answer is option C, 38 degrees Celsius. Now let's move to question number 11. Which of the following is a contraindication for whirlpool therapy? Option A, osteoarthritis. Option B, loss of sensation. Option C, muscle spasm. Option D, chronic edema. And the answer is option B, loss of sensation. Now let's move to question number 12. Which effect is primarily achieved by water agitation in a whirlpool bath? Option A, vasoconstriction. Option B, mechanical stimulation and pain relief. Option C, decreased circulation. Option D, increased skin thickness. And answer is option B, mechanical stimulation and pain relief. Now let's move to question number 13. Why should vigorous agitation be avoided in wound care during whirlpool therapy? Option A, it increases pain. Option B, it reduces circulation. Option C, it causes hypothermia. Option D, it can stop wound healing. And answer is option D, it can stop wound healing. Now let's move to question number 14. Which of the following is a unique feature of urban tank compared to standard whirlpool bath? Option A, use of hot packs. Option B, the whole body immersion and underwater exercise. Option C, only for upper limb treatment. Option D, no temperature control. And answer is option B, the whole body immersion and underwater exercise. Now let's move to question number 15. What is the primary mechanism of pain relief in hydrotherapy? Option A, gate control mechanism via thermal and mechanical stimulation. Option B, decreased blood flow. Option C, increased muscle spasm. Option D, reduced oxygen supply. And answer is option A, gate control mechanism via thermal and mechanical stimulation. Now let's move to question number 16. Which of the following is not a physical property of water utilized in hydrotherapy? Option A, buoyancy. Option B, hydrostatic pressure. Option C, viscosity. Option D, magnetism. And answer is option D, magnetism. Now let's move to question number 17. Which patient population requires extra caution during hydrotherapy due to risk of burns? Option A, young adult. Option B, elderly patients. Option C, athletes. Option D, patients with muscular hypertrophy. And answer is option B, elderly patient. Now let's move to question number 18. What is the main purpose of using different tank size in whirlpool therapy? Option A, to control water temperature. Option B, to accommodate different body parts. Option C, to increase water pressure. Option D, to filter water. And answer is option B, to accommodate different body parts. Now let's move to question number 19. Which of the following is a potential danger of hydrotherapy in patients with poor circulation? Option A, enhanced wound healing. Option B, improved muscle strength. Option C, increased risk of burns. Option D, reduced edema. And answer is option C, increased risk of burns. Now let's move to question number 20. Which is a common clinical use of aquatic therapy, underwater exercise? Option A, muscle re-education and joint mobilization. Option B, rapid wound closure. Option C, bone lengthening. Option D, nerve regeneration. And answer is option A, muscle re-education and joint mobilization. So let's start with the learning tip. Frequency effect. Low is 2 to 10 Hz. Endogenous opioids. High is 50 to 100 Hz. Gate control. Electrode placement for sensory and motor. Pulse width of 50 to 250 milliseconds. And contraindication pacemakers. Pregnancy over abdomen. Carotid sinus. This repeats 85% of the TENS questions across all exams. What is the primary mechanism of pain relief in conventional TENS? Option A, muscle contraction. Option B, gate control theory activation. Option C, increased blood flow. Option D, nerve regeneration. And answer is option B, gate control theories activation. Now let's move to question number 2. Which type of current is used in TENS therapy? Option A, direct current. Option B, alternating current. Option C, pulsed current. Option D, static current. And the answer is... Now let's move to question number 3. Typical pulse duration for conventional TENS. Option A, 1 to 10 microsecond. Option B, 2 to 5 millisecond. Option C, 500 to 1000 microseconds. Option D, 50 to 200 microseconds. And the answer is... option D, 50 to 200 microseconds. Now let's move to question number 4. Frequency range for conventional TENS. Option A, 1 to 4 Hz. Option B, 5 to 20 Hz. Option C, 50 to 150 Hz. Option D, 200 to 300 Hz. And answer is option C, 50 to 150 Hz. Now let's move to question number 5. Which of the following is not a contraindication for TENS therapy? Option A, over the carotid sinus. Option B, over the pacemaker. Option C, over the intact skin. Option D, over the eyes. And the answer is option C, over the intact skin. Now let's move to question number 6. Which type of TENS is best suited for acute pain management? Option A, acupuncture-like TENS. Option C, burst mode TENS. Option C, brief intense TENS. Option D, conventional TENS. And the answer is option D, conventional TENS. Now let's move to question number 7. The main advantage of modulated TENS over conventional TENS is option A, higher intensity delivery. Option B, reduced nerve adaptation. Option C, target deeper tissue. Option D, produces muscle contraction. And the answer is option B, reduces nerve adaptation. Now let's move to question number 8. Recommended electrode placement for TENS is option A, along the major arteries. Option B, over the painful area or along dermatome. Option C, over wound or surgical incisions. Option D, directly over bony prominence. And the answer is option B, over the painful area or along the dermatome. Now let's move to question number 9. The most common side effect of TENS therapy is option A, skin irritation. Option B, muscle soreness. Option C, headache. Option D, dizziness. And the answer is option A, skin irritation. Now let's move to question number 10. Which type of pain is least responsive to TENS? Option A, superficial somatic pain. Option B, neuropathic pain. Option C, musculoskeletal pain. Option D, deep visceral pain. And the answer is option D, deep visceral pain. Now let's move to question number 11. The primary mechanism of acupuncture-like TENS is Option A, gate control theory activation. Option B, endogenous opioid release. Option C, segmental inhibition. Option D, muscle fatigue. And the answer is option B, endogenous opioid release. Now let's move to question number 12. Which of the following is a valid indication for TENS therapy? Option A, over the anterior neck region. Option B, post-operative pain management. Option C, during pregnancy over the abdomen. Option D, over the implanted electronic device. And the answer is option B, post-operative pain management. Now let's move to question number 13. The brief intense TENS compared to conventional TENS, which parameter are increased? Option A, frequency only. Option B, pulse duration only. Option C, amplitude only. Option D, frequency, pulse duration and amplitude. And the answer is option D, frequency, pulse duration and amplitude. Now let's move to question number 14. During TENS therapy, which precaution is most important? Option A, do not place electrode over the anterior neck. Option B, avoid use in sensation is impaired. Option C, do not apply during pregnancy or the abdomen. Option D, avoid use while driving or operating machinery. And the answer is option D, avoid use while driving or operating machinery. Now let's move to question number 15. Which nerve fibers are primarily stimulated by conventional TENS? Option A delta fiber. Option B, C fibers. Option C, A beta fibers. Option D, motor fibers. And the answer is option C, A beta fibers. Now let's move to question number 16. Which of the following is not a benefit of TENS therapy? Option A, non-invasive pain control. Option B, minimal side effects. Option C, permanent nerve block. Option D, portable and easy to use. And the answer is option C, permanent nerve block. Now let's move to question number 17. Recommended duration for typical TENS session. Option A, 5 to 10 minutes. Option B, 10 to 30 minutes. Option D, 60 to 90 minutes. Option D, overnight continuous use. And the answer is option B, 10 to 30 minutes. Now let's move to question number 18. Which TENS mode is best for chronic pain with tolerance to conventional TENS? Option A, brief intense TENS. Option B, burst mode TENS. Option C, acupuncture-like TENS. Option D, modulated TENS. And the answer is option D, modulated TENS. Now let's move to question number 19. Which of the following is a contraindication for TENS therapy? Option A, over spinal cord stimulator. Option B, over intact skin. Option C, over peripheral nerve. Option D, along dermatome distribution. And the answer is option A, over spinal cord stimulator. Now let's move to question number 20. A sign that TENS intensity is set too high is option A, mild tingling sensation. Option B, comfortable paresthesia. Option C, painful muscle contraction. Option D, no sensation at all. And the answer is option C, painful muscle contraction. Now let's start with the learning tip. ESWT indications: chronic tendinopathy, plantar fasciitis, non-union fractures. Energy flex density, that's 0.09 to 0.4 millijoules per millimeter square. Contraindication: pregnancy, lungs, major vessels infections, and the phases of healing, proliferation stimulation. This repeats 80% of shockwave questions across all exams. So let's start with question number 1. What is the primary mechanism of action of shockwave therapy in musculoskeletal tissue? Option A, deep tissue heating. Option B, mechanical stimulation and cavitation. Option C, electrical nerve block. Option D, drug delivery. And the answer is option B, mechanical stimulation and cavitation. Now let's move to question number 2. Which of the following is a common clinical indication of shockwave therapy? Option A, acute fracture. Option B, peripheral neuropathy. Option C, acute infection. Option D, plantar fasciitis. And the answer is option D, plantar fasciitis. Now let's move to question number 3. What is the typical energy range used in focused shockwave therapy for musculoskeletal conditions? Option A, 0.08 to 0.28 millijoules per millimeter square. Option B, 0.01 to 0.1 millijoules per millimeter square. Option C, 1 to 10 millijoules per millimeter square. Option D 10 to 100 millijoules per millimeter square, and the answer is option A 0.08 to 0.28 millijoules per millimeter square. Now let's move to question number 4. Which of the following is not a recognized side effect of shockwave therapy? Option A stimulation of neovascularization. Option B increased collagen synthesis. Option C permanent nerve block. Option D breakdown of calcific deposits. And the answer is option C permanent nerve block. Now let's move to question number 5. What is the main advantage of radial shockwave therapy compared to focused shockwave therapy? Option A greater tissue penetration. Option B less discomfort and broader area of effect. Option C higher risk of tissue damage. Option D used only for bone healing. And answer is option B less discomfort and broad area effect. Now let's move to question number 6. Which of the following is contraindication for shockwave therapy? Option A chronic tendinopathy. Option B plantar fasciitis. Option C over the open wound. Option D calcific shoulder tendinitis. And the answer is option C over open wounds. Now let's move to question number 7. What is the typical session frequency for shockwave therapy in most protocols? Option A daily. Option B every 2 to 7 days. Option C once a month. Option D only once. And the answer is option B every 2 to 7 days. Now let's move to question number 8. Which of the following is a common side effect of shockwave therapy? Option A systemic toxicity. Option B permanent skin discolorization. Option C muscle hypertrophy. Option D localized pain or bruising. And the answer is option D localized pain or bruising. Now let's move to question number 9. What is the main proposed benefit of shockwave therapy in chronic tendinopathies? Option A immediate pain relief. Option B stimulation of tissue regeneration and remodeling. Option C reduction of muscle mass. Option D permanent loss of function. And the answer is option B stimulation of tissue regeneration and remodeling. Now let's move to question number 10. Which parameter is most critical for the effectiveness of shockwave therapy? Option A energy flux density. Option B room temperature. Option C patient age. Option D skin color. And answer is option A energy flux density. Now let's move to question number 11. Which of the following is not an indication for shockwave therapy? Option A Achilles tendinopathy. Option B lateral epicondylitis. Option C acute deep vein thrombosis. Option D calcified shoulder tendinitis. And answer is option C acute deep vein thrombosis. Now let's move to question number 12. What is the main mechanism by which shockwave therapy helps resolve calcific deposit? Option A melting the deposits. Option B blocking nerve conduction. Option C increasing the blood viscosity. Option D mechanical fragmentation and cavitation. And the answer is option D mechanical fragmentation and cavitation. Now let's move to question number 13. Which patient group requires extra caution during shockwave therapy? Option A young adult. Option B elderly with impaired sensation. Option C athletes. Option D children with muscular hypertrophy. And the answer is option B elderly with impaired sensation. Now let's move to question number 14. Which of the following is a sign of excessive intensity during shockwave therapy? Option A mild tingling. Option B comfortable warmth. Option C sharp pain or significant bruising. Option D no sensation. And the answer is option C sharp pain or significant bruising. Now let's move to question number 15. Which is the key safety step before starting shockwave therapy? Option A apply over jewelry. Option B removal of all jewelry and metal objects from the treatment area. Option C use maximum intensity from the start. Option D ignore patient feedback. And the answer is option B remove all jewelry and metal objects from the treatment area. Now let's move to question number 16. What is the main advantage of shockwave therapy over surgery for tendinopathies? Option A non-invasive, low risk and fast recovery. Option B immediate cure. Option C requires anesthesia. Option D higher complication rate. And the answer is option A non-invasive, low risk and fast recovery. Now let's move to question number 17. Which of the following is not a benefit of shockwave therapy? Option A, stimulate tissue regeneration. Option B, increase the blood flow. Option C, cause permanent nerve block. Option D, reduce pain. And the answer is option C, cause permanent nerve block. Now let's move to question number 18. What is the recommended post-treatment care after shockwave therapy? Option A, immediate intense exercise. Option B, rest, gradual return to activity. Option C, application of ice pack for 24 hours. Option B, use of topical antibiotics. And the answer is option B, rest and gradual return to activity. Now let's move to question number 19. Which of the following is a contraindication for shockwave therapy? Option A, chronic plantar fasciitis. Option B, over the areas with active infection or tumor. Option C, chronic Achilles tendinopathy. Option D, patellar tendinopathy. And the answer is option B, over the area with active infection or tumor. Now let's move to question number 20. Which is the main clinical outcome measured after shockwave therapy for tendinopathy? Option A, increased joint laxity. Option B, decreased bone intensity. Option C, permanent loss of strength. Option D, pain reduction and function improvement. And the answer is option D, pain reduction and functional improvement. Let's start with the learning tip. Photobiomodulation mechanism. Wavelength selection. Red is 630 to 680 nanometers superficial. Infrared 800 to 900 nanometers depth. Dosage 4 to 8 joules per centimeter square. Contraindications: direct to our eyes, pregnancy, abdomen, active cancer. And indications: wound healing arthritis. This repeats 80% of laser questions across all exams. Let's move to question number 1. What does the acronym LASER stands for in physiotherapy? Option A, light amplification by stimulated emission of the radiation. Option B, light absorption by stimulated emission of radiation. Option C,
low amplification by spontaneous emission of radiation.
Option D, light amplification by spontaneous emission of radiation. And answer is option A, light amplification by stimulated emission of radiation. Now let's move to question number 2. Which property is not a characteristic of laser beam? Option A, monochromatic. Option B, coherent. Option C, collimated. Option D, polychromatic. And the answer is option D, polychromatic. Now let's move to question number 3. What is the main mechanism of action of low-level laser therapy? Option A, deep tissue heating. Option B, photobiostimulation. Option C, muscle contraction. Option D, nerve conduction block. And the answer is option B, photobiostimulation. Now let's move to question number 4. Which wavelength range is most commonly used in therapeutic lasers for physiotherapy? Option A, 100 to 400 nanometers. Option B, 600 to 1000 nanometer. Option C, 2000 to 3000 nanometers. Option D, 10,000 to 12,000 nanometer. And answer is option B, 600 to 1000 nanometer. Now let's move to question number 5. Which of the following is a primary therapeutic effect of LLT? Option A, increased collagen extensibility. Option B, deep muscle heating. Option C, enhanced wound healing. Option D, vasoconstriction. And answer is option C, enhanced wound healing. Now let's move to question number 6. Which type of laser is most commonly used in physiotherapy for superficial tissue heating? Option A, CO2 laser. Option B, excimer laser. Option C, argon laser. Option D, helium neon laser. And the answer is option D, helium neon laser. Now let's move to question number 7. What is the primary safety concern when using therapeutic lasers? Option A, eye damage. Option B, skin dehydration. Option C, muscle atrophy. Option D, hypopigmentation. And the answer is option A, eye damage. Now let's move to question number 8. Which of the following is not an indication for LLT? Option A, chronic wounds. Option B, acute inflammation. Option C, cancerous lesions. Option D, tendinitis. And answer is option C, cancerous lesion. Now let's move to question number 9. What is a typical penetration depth of gallium arsenide laser in soft tissue? Option A, 1 to 2 mm. Option B, 1 to 2 centimeters. Option C, 5 to 10 centimeters. Option D, 10 to 15 centimeters. And answer is option B, 1 to 2 centimeters. Now let's move to question number 10. Which property allows laser light to remain focused over long distance? Option A, monochromicity. Option B, coherence. Option C, collimation. Option D, polarization. And answer is option C, collimation. Now let's move to question number 11. Which of the following is a contraindication for laser therapy? Option A, tendinitis. Option B, open wound. Option C, ice. Option D, chronic pain. And answer is option C, ice. Now let's move to question number 12. Which class of laser is considered safe for general use in physiotherapy? Option A, class 1. Option B, class 2. Option C, class 3B. Option D, class 4. And answer is option B, class 2. Now let's move to question number 13. Which is the key mechanism for pain relief by LLLT? Option A, nerve conduction block. Option B, endorphin release and anti-inflammatory effect. Option C, muscle fiber destruction. Option D, vasoconstriction. And the answer is option B, endorphin release and anti-inflammatory effect. Now let's move to question number 14. What is the main advantage of LLLT over conventional heat modalities? Option A, deeper tissue penetration. Option B, lower cost. Option C, faster application time. Option D, non-thermal mechanism. And the answer is option D, non-thermal mechanism. Now let's move to question number 15. Which of the following is a therapeutic effect of LLLT on bone healing? Option A, increases collagen production and angiogenesis. Option B, inhibits osteoblast proliferation. Option C, decreases calcium deposition. Option D, causes bone reabsorption. And the answer is option A, increases collagen production and angiogenesis. Now let's move to question number 16. Which of the following is not a property of laser light? Option A, monochromatic. Option B, coherent. Option C, divergent. Option D, collimated. And the answer is option C, divergent. Now let's move to question number 17. Which patient group should avoid laser therapy over the abdominal area? Option A, elderly patient. Option B, pregnant woman. Option C, children. Option D, athletes. And answer is option B, pregnant woman. Now let's move to question number 18. Which of the following is not a recognized indication for laser therapy? Option A, acute infection. Option B, nerve entrapment syndrome. Option C, soft tissue injuries. Option D, wound healing. And the answer is option A, acute infection. Now let's move to question number 19. Which of the following is a precaution during laser therapy? Option A, use over pacemakers. Option B, use over neoplastic tissues. Option C, use protective goggles. Option D, use over open wounds. And answer is option C, use protective goggles. Now let's move to question number 20. Which term describes the process by which a laser light stimulates cellular activity? Option A, photobiomodulation. Option B, thermogenesis. Option C, electrolysis. Option D, chemotaxis. And the answer is option A, photobiomodulation. Let's start with the learning tip. Faradic AC, tetanizing muscle strengthening versus galvanic direct current, denervated muscle. Electrode placement, motor points, current parameters 50 to 100 Hz, tetany, and contraindication, thrombosis, epilepsy, pregnancy. This repeat 85% of EMS questions across all exams. So let's move to question number 1. What is the primary therapeutic goal for electrical muscle stimulation in physiotherapy? Option A, pain relief only. Option B, muscle strengthening and re-education. Option C, bone healing. Option D, increasing skin thickness. And answer is option B, muscle strengthening and re-education. Now let's move to question number 2. Which type of current is used in Faradic stimulation? Option A, continuous direct current. Option B, interrupted direct current. Option C, alternating current with short duration pulses. Option D, high frequency sinusoidal current. And answer is option C, alternating current with short duration pulses. Now let's move to question number 3. What is the typical pulse duration for Faradic current? Option A, 0.01 to 0.1 millisecond. Option B, 0.1 to 1 millisecond. Option C, 1 to 10 millisecond. Option D, 100 to 500 millisecond. And the answer is option B, 0.1 to 1 millisecond. Now let's move to question number 4. Which muscle type is best stimulated by galvanic current? Option A, normally innervated muscle. Option B, cardiac muscle. Option C, smooth muscle. Option D, de-innervated muscle. And the answer is option D, de-innervated muscle. Now let's move to question number 5. What is the main difference between Faradic and galvanic stimulation? Option A, Faradic uses direct current, galvanic uses alternating current. Option B, Faradic is for de-innervated muscle, galvanic is for innervated muscle. Option C, Faradic uses short duration AC pulses, galvanic uses long duration DC pulses. Option D, both use the same type current. And the answer is option C, Faradic uses short duration AC pulses, galvanic uses long duration DC pulses. Now let's move to question number 6. Which of the following is not an indication for EMS? Option A, muscle re-education. Option B, prevention of muscle atrophy. Option C, over malignant tumor. Option D, improving voluntary muscle control. And the answer is option C, over malignant tumor. Now let's move to question number 7. What is the typical frequency range for Faradic stimulation? Option A, 1 to 5 Hz. Option B, 10 to 50 Hz. Option C, 50 to 100 Hz. Option D, 200 to 400 Hz. And the answer is option B, 10 to 50 Hz. Now let's move to question number 8. Which electrode placement is most effective for stimulating a specific muscle? Option A, over the muscle belly and motor point. Option B, over the bony prominence. Option C, over the skin only. Option D, over a joint. And the answer is option A, over the muscle belly and motor point. Now let's move to question number 9. Which of the following is a contraindication for EMS? Option A, muscle weakness. Option B, post-operative immobilization. Option C, muscle spasm. Option D, over pacemaker. And the answer is option D, over pacemaker. Now let's move to question number 10. What is the main physiological effect of Faradic stimulation on the muscle? Option A, muscle contraction and strengthening. Option B, increased muscle atrophy. Option C, decreased blood flow. Option D, nerve degeneration. And the answer is option A, muscle contraction and strengthening. Now let's move to question number 11. What is the common clinical use for galvanic stimulation? Option A, treating chronic pain. Option B, stimulating de-innervated muscle for nerve injury. Option C, increasing skin pigmentation. Option D, reducing bone spur. And the answer is option B, stimulating de-innervated muscle after nerve injury. Now let's move to question number 12. What is the recommended treatment duration for typical EMS session? Option A, 1 to 2 minutes. Option B, 5 to 10 minutes. Option C, 15 to 20 minutes. Option D, 1 hour. And the answer is option C, 15 to 20 minutes. Now let's move to question number 13. Which of the following is a sign of excessive EMS intensity? Option A, mild tingling. Option B, comfortable muscle contraction. Option C, sharp pain or burning sensation. Option D, slight redness. And the answer is option C, sharp pain or burning sensation. Now let's move to question number 14. Which parameter is increased to strengthen muscles contraction during EMS? Option A, pulse duration. Option B, frequency. Option C, amplitude. Option D, all of the above. And the answer is option D, all of the above. Now let's move to question number 15. Which is not a benefit of EMS in rehabilitation? Option A, prevents muscle atrophy. Option B, improves voluntary muscle control. Option C, causes permanent nerve block. Option D, enhance muscle strength. And the answer is option C, cause permanent nerve block. Now let's move to question number 16. Which of the following is a precaution during EMS application? Option A, use over intact skin. Option B, use in patients with impaired sensation. Option C, use over muscle bellies. Option D, use in healthy adults. And the answer is option B, use in patients with impaired sensation. Now let's move to question number 17. What is the main mechanism of muscle contraction in Faradic stimulation? Option A, stimulation of motor nerves. Option B, direct stimulation of muscle fibers. Option C, stimulation of sensory nerve only. Option D, direct current flow through muscles. And the answer is option A, stimulation of motor nerves. Now let's move to question number 18. Which of the following is not an indication for Faradic stimulation? Option A, muscle strengthening. Option B, muscle re-education. Option C, de-innervated muscle stimulation. Option D, preventing muscle atrophy. And answer E is option C, de-innervated muscle stimulation. Now let's move to question number 19. Which is a correct safety measure before starting EMS? Option A, remove all jewelry and metal objects. Option B, apply over open wounds. Option C, use maximum intensity from the start. Option D, ignore the patient's feedback. And answer E is option A, remove all jewelry and metal objects. Now let's move to question number 20. What is the main advantage of using EMS in post-surgical rehabilitation? Option A, causes muscle atrophy. Option B, restore voluntary muscle function and prevents disuse atrophy. Option C, increases risk of infection. Option D, reduce joint mobility. And answer E is option B, restore voluntary muscle function and prevents disuse atrophy. Let's move to the learning tip. 2500 Hz carrier frequency with 50 bursts per second. Indications are muscle strengthening, atrophy prevention. Electrode placements are motor points versus Russian versus EMS distinctions and contraindications. Thrombophlebitis, epilepsy. This repeats 85% of Russian stimulations for all exams. So let's move to question number 1. What is the carrier frequency typically used in Russian stimulation? Option A, 1000 Hz. Option B, 2500 Hz. Option C, 50 Hz. Option D, 10,000 Hz. And answer is option B, 2500 Hz. Now let's move to question number 2. What is the standard burst frequency used in Russian current protocols for muscle strengthening? Option A, 10 Hz. Option B, 20 Hz. Option C, 50 Hz. Option D, 100 Hz. And answer is option C, 50 Hz. Now let's move to question number 3. Which of the following is the classic Russian stimulation protocol known as? Option A, 10:10:10. Option B, 20:20:20. Option C, 5:20:5. Option D, 10:50:10. And answer is option D, 10:50:10. Now let's move to question number 4. What is the primary clinical use of Russian stimulation in physiotherapy? Option A, pain relief. Option B, muscle strengthening. Option C, wound healing. Option D, bone fracture healing. And answer is option B, muscle strengthening. Now let's move to question number 5. What waveform characterizes Russian stimulation? Option A, monophasic pulse current. Option B, biphasic symmetrical pulse current. Option B, burst modulated sinusoidal alternating current. Option D, direct current. And the answer is option C, burst modulated sinusoidal alternating current. Now let's move to question number 6. Which muscle fiber type is peripherally activated by Russian stimulation? Option A, type 1 slow twitch. Option B, type 2 fast twitch. Option C, cardiac muscle fibers. Option D, smooth muscle fibers. And the answer is option B, type 2 fast twitch. Now let's move to question number 7. What is the typical duty cycle used in Russian stimulation? Option A, 10%. Option B, 25%. Option C, 50%. Option D, 100%. And the answer is option C, 50%. Now let's move to question number 8. Which electrode placement is optimal for Russian stimulation? Option A, over body prominence. Option B, random placement. Option C, over the joint only. Option D, parallel to the direction of muscle fibers. And the answer is option D, parallel to the direction of muscle fibers. Now let's move to question number 9. What is the recommended ramp up and ramp down time for Russian stimulation? Option A, 0.1 second. Option B, 1 to 2 second. Option C, 10 second. Option D, 30 second. And the answer is option B, 1 to 2 seconds. Now let's move to question number 10. What is the main mechanism of muscle contraction in Russian stimulation? Option A, depolarization of motor nerves. Option B, direct stimulation of muscle fibers. Option C, stimulation of sensory nerve only. Option D, direct current flow through muscles. And the answer is option A, depolarization of motor nerves. Now let's move to question number 11. Which waveform is most commonly used in HVPC therapy? Option A, monophasic twin peaked pulse. Option B, biphasic symmetrical pulse. Option C, sine wave. Option D, continuous direct current. And the answer is option A, monophasic twin peaked pulse. Now let's move to question number 12. What is the typical pulse duration for HVPC? Option A, 1 to 10 millisecond. Option B, 50 to 1000 microsecond. Option C, 20 to 200 millisecond. Option D, 5 to 10 seconds. And the answer is option B, 50 to 1000 microsecond. Now let's move to question number 13. Which electrode configuration is the most commonly used for wound healing in HVPC? Option A, bipolar. Option B, tripolar. Option C, quadripolar. Option D, monopolar. And the answer is option D, monopolar. Now let's move to question number 14. Which polarity is generally used during the early inflammatory phase of wound healing in HVPC? Option A, positive. Option B, negative. Option C, alternating. Option D, biphasic. And the answer is option B, negative. Now let's move to question number 15. What is the typical current intensity used in microcurrent therapy? Option A, 1 to 5 milliampere. Option B, 100 to 500 microampere. Option C, 1 to 199 microampere. Option D, 10 to 50 milliampere. And the answer is option C, 1 to 999 microampere. Now let's move to question number 16. Which of the following best describes the physiological effect of microcurrent therapy? Option A, causes strong muscle contraction. Option B, stimulate ATP production and cellular repair. Option C, increases skin temperature. Option D, block nerve conduction. And the answer is option B, stimulate ATP production and cellular repair. Now let's move to question number 17. Which waveform is most commonly used in microcurrent therapy? Option A, pulsed biphasic current. Option B, continuous direct current. Option C, high frequency sinusoidal current. Option D, burst modulated current. And the answer is option A, pulsed biphasic current. Now let's move to question number 18. What is the typical duration of microcurrent therapy session? Option A, 1 to 2 minutes. Option B, 5 to 10 minutes. Option C, 20 to 40 minutes. Option D, 1 hour. And the answer is option C, 20 to 40 minutes. Now let's move to question number 19. What is the main advantage of microcurrent therapy compared to conventional TENS? Option A, strong muscle contraction. Option B, subsensory stimulation with minimal discomfort. Option C, higher risk of burns. Option D, longer treatment times. And the answer is option B, subsensory stimulation with minimal discomfort. Now let's move to question number 20. Which electrode placement is preferred for microcurrent therapy in wound healing? Option A, over the bony prominences. Option B, one electrode over the wound and the other on the intact skin nearby. Option C, over joints only. Option D, random placement. And the answer is option B, one electrode over the wound and the other on the intact skin nearby. Now let's start with the learning tip. Hierarchy of evidence, RCTs versus cohort case studies, PICO framework, critical appraisal, validity, results, applicability, levels of evidence classification, clinical decision making process. This repeats 85% of evidence-based questions across all exams. So let's move to question number 1. What is the primary goal of evidence-based practice in electrotherapy? Option A, to integrate best research evidence, clinical expertise, and patient value. Option B, to rely solely on traditional clinical experience. Option C, to use only the latest device. Option D, to eliminate patient preferences. And the answer is option A, to integrate best research evidence, clinical expertise, and patient value. Now let's move to question number 2. Which of the following is considered the highest level of evidence in clinical decision making? Option A, case series. Option B, randomized controlled trials. Option C, expert options. Option D, animal series. And the answer is option B, randomized controlled trials. Now let's move to question number 3. What is the main advantage of using systemic reviews in electrotherapy research? Option A, they are based on a single study. Option B, they ignore patient's outcome. Option C, they focus only on laboratory experiments. Option D, they synthesize findings from multiple studies to prove comprehensive conclusions. And the answer is option D, they emphasize findings from multiple studies to provide comprehensive conclusions. Now let's move to question number 4. Which parameter is most critical when evaluating effectiveness of new electrotherapy device? Option A, manufacturer's marketing claims. Option B, patients report outcome and objective clinical measures. Option C, device color. Option D, price only. And the answer is option B, patient reported outcome, objective and clinical measures. Now let's move to question number 5. Which of the following is not a common bias in electrotherapy research? Option A, selection bias. Option B, performance bias. Option C, publication bias. Option D, frequency bias. And the answer is option D, frequency bias. Now let's move to question number 6. Why is blending important in electrotherapy clinical trials? Option A, to hide the device from the therapist. Option B, to increase treatment cost. Option C, to reduce placebo effect and observer's bias. Option D, to make the study longer. And the answer is option C, to reduce placebo effect and observer's bias. Now let's move to question number 7. Which outcome measures is most appropriate for assessing pain relief after TENS therapy? Option A, visual analog scale. Option B, body mass index. Option C, blood glucose level. Option D, heart rate. And the answer is option A, visual analog scale. Now let's move to question number 8. What is the main benefit of using standardized treatment protocols in electrotherapy research? Option A, facilitate comparison and replication of studies. Option B, increase variability in result. Option C, reduce patient adherence. Option D, limits treatment options. And the answer is option A, facilitate comparison and replication of the studies. Now let's move to question number 9. Which of the following is a limitation of case reports in electrotherapy literature? Option A, high generalizability. Option B, lack of control group. Option C, large sample size. Option D, systematic data collection. And the answer is option B, lack of control group. Now let's move to question number 10. What is the primary ethical consideration when conducting electrotherapy research on human subjects? Option A, maximizing sample size. Option B, obtaining informed consent. Option C, using latest devices. Option D, publishing only positive result. And the answer is option B, obtaining informed consent. Now let's move to question number 11. What is the statistical measures is the most important for determining the clinical significance of electrotherapy outcome? Option A, p-value. Option B, device cost. Option C, effect size. Option D, study duration. And the answer is option C, effect size. Now let's move to question number 12. Which type of study best identifies adverse effect of electrotherapy modality? Option A, case control studies. Option B, randomized control trials. Option C, systemic review. Option D, post-marketing surveillance study. And the answer is option B, post-marketing surveillance study. Now let's move to question number 13. What is the main purpose of placebo or sham control in electrotherapy research? Option A, to deceive patients. Option B, to control non-specific effect and isolate the true effect of intervention. Option C, to increase cost. Option D, to reduce study duration. And the answer is option B, to control non-specific effect and isolate true effect of intervention. Now let's move to question number 14. Which of the following is not a recommended step in critically appraising an electrotherapy research article? Option A, assessing the study design and methodology. Option B, checking the conflicts of interest. Option C, focusing only on the abstract. Option D, evaluating the relevance of result to clinical practice. And the answer is option C, focus only on the abstract. Now let's move to question number 15. Why is the patient-centered care important in evidence-based electrotherapy? Option A, it ignores patient preferences. It ensures treatment aligns with individual values, needs, and circumstances. Option C, it standardizes all treatment. Option D, it eliminates the need of research evidence. And the answer is Option B, it ensures treatment aligns with individual values, needs and circumstances. Now let's move to question number 60. Which of the following is a common outcome measures for functional improvement after NMES? Option A, manual muscle testing. Option B, visual analog scale. Option C, blood pressure. Option D, serum calcium level. And the answer is option A, manual muscle testing. That's MMT. Now let's move to question number 17. What is the main reason for registering clinical trials in electrotherapy? Option A, to increase publication bias. Option B, to promote transparency and reduce selective reporting. Option C, to restrict access to data. Option D, to limit sample size. And the answer is option B, to promote transparency and reduce selective reporting. Now let's move to question number 18. Which of the following is a limitation of meta-analysis in electrotherapy research? Option A large sample size. Option B, use of standardized protocols. Option C, heterogeneity of included studies. Option D, comprehensive data synthesis. The answer is option C, heterogeneity of included studies. Now let's move to question number 19. Which is the key safety consideration when applying new electrotherapy modality in practice? Option A, relying solely on manufacturer's claim. Option B, monitoring for adverse effect and following evidence-based by guidelines. Option C, ignoring patient feedback. Option D, maximizing intensity regardless of tolerance. And the answer is option B, monitoring for adverse effect and following evidence-based guidelines. Now let's move to question number 20. What is the main purpose of outcome audit in electrotherapy practice? Option A, to punish clinicians. Option B, to evaluate and improve the quality of patient care. Option C, to increase paperwork. Option D, to reduce treatment options. And the answer is option B, to evaluate and improve the quality of patient care. Now let's start with the learning tip. UVA pigmentation 320 to 400 nanometers. UVB erythema vitamin D 280 to 320 nanometers. UVC germicidal less than 280 nanometers. Minimal erythema dose, that's MED. Indications psoriasis, angina, vitiligo. And contraindication photosensitivity, SLE, acute herpes. And this repeats 85% of UVR questions across all exams. So let's move to question number 1. What is the wavelength range for ultraviolet radiation used in physiotherapy? Option A, 10 to 100 nanometers. Option B, 100 to 400 nanometers. Option C, 400 to 700 nanometers. Option D, 700 to 1000 nanometers. And the answer is option B, 100 to 400 nanometers. Now let's move to question number 2. Which type of UVR is most effective for synthesis of vitamin D in human skin? Option A, vacuum UV. Option B, UVC. Option C, UVB. Option D, UVA. And the answer is option C, UVB. Now let's move to question number 3. Which artificial UVR source is commonly used in physiotherapy treatments? Option A, sunlight. Option B, halogen light. Option C, LED lamp. Option D, mercury vapor lamp. And the answer is option D, mercury vapor lamp. Now let's move to question number 4. Which of the following is primary physiological effect of UVR on the skin? Option A, erythema. Option B, increased collagen extensibility. Option C, vasoconstriction. Option D, muscle stimulation. And the answer is option A, erythema. Now let's move to question number 5. Which band of UVR is most commonly found in natural sunlight at Earth's surface? Option A, UVA. Option B, UVB. Option C, UVC. Option D, far UV. And the answer is option A, UVA. Now let's move to question number 6. Which law states that UVR must be absorbed to the biological effect of tissue? Option A, cosine law. Option B, inverse square law. Option C, Grotha's-Dapper law. Option D, Arnold-Klotz principle. And the answer is option C, Grotha's-Dapper law. Now let's move to question number 7. Which of the following is a therapeutic effect of UVR? Option A, induction of muscle atrophy. Option B, acceleration of wound healing. Option C, induction of joint stiffness. Option D, decrease in skin thickness. And the answer is Option B, acceleration of wound healing. Now let's move to question number 8. Which musculoskeletal condition has the strongest evidence of PEMF therapy? Option A, plantar fasciitis. Option B, acute skin wound. Option C, acute muscle strain. Option D, non-union bone fractures. And the answer is option D, non-union bone fractures. Now let's move to question number 9. What is the typical frequency range of PEMF used in clinical practice? Option A, 0.1 to 10 Hz. Option B, 10 to 100 Hz. Option C, 100 to 1000 Hz. Option D, 10,000 to 20,000 Hz. And the answer is option B, 10 to 100 Hz. Now let's move to question number 10. What is the recommended session duration of PEMF therapy in bone healing? Option A, 1 to 2 minutes. Option B, 10 to 20 minutes. Option C, 30 to 60 minutes. Option D, 2 hours. And the answer is option C, 30 to 60 minutes. Now let's move to question number 11. What is the primary purpose of iontophoresis in physiotherapy? Option A, deep tissue heating. Option B, transdermal drug delivery using electrical current. Option C, muscle strengthening. Option D, pain relief through vibration. And the answer is option B, transdermal drug delivery using electrical current. Now let's move to question number 12. Which type of current is used in iontophoresis? Option A, alternating current. Option B, pulsed current. Option C, direct current. Option D, high frequency current. And the answer is option C, direct current. Now let's move to question number 13. Which of the following drug is commonly delivered using negative electrode in iontophoresis? Option A, lidocaine. Option B, dexamethasone. Option C, hydrocortisone. Option D, zinc oxide. And the answer is option B, dexamethasone. Now let's move to question number 14. Which parameter is most critical for effective iontophoresis? Option A, frequency. Option B, duration of application. Option C, electrode size. Option D, current density. And the answer is option D, current density. Now let's move to question number 15. Which of the following drug is delivered using positive electrode in iontophoresis? Option A, salicylate. Option B, dexamethasone. Option C, lidocaine. Option D, acetic acid. And the answer is option C, lidocaine. Now let's move to question number 16. What is the recommended maximum current density for iontophoresis on forearm? Option A, 0.1 microampere per centimeter square. Option B, 0.5 microampere per centimeter square. Option C, 1 microampere per centimeter square. Option D, 2 microampere per centimeter square. And the answer is option B, 0.5 microampere per centimeter square. Now let's move to question number 17. Which electrode is called the active electrode in iontophoresis? Option A, the one with opposite charge to the drug. Option B, the one with the same charge as the drug. Option C, the ground electrode. Option D, the disruptive electrode. And the answer is option B, the one with the same charge as the drug. Now let's move to question number 18. What type of electrode is typically used for surface EMG biofeedback? Option A, needle electrode. Option B, plate electrode. Option C, suction electrode. Option D, surface electrode. And the answer is option D, surface electrode. Now let's move to question number 19. What is the typical frequency range of EMG signals recorded from skeletal muscle? Option A, 0.1 to 1 Hz. Option B, 10 to 20 kHz. Option C, 1 to 5 kHz. Option D, 10 to 500 Hz. And the answer is option D, 10 to 500 Hz. Now let's move to question number 20. Which of the following is a sign of excessive effort during EMG biofeedback training? Option A, mild muscle activation. Option B, comfortable feedback signals. Option C, muscle fatigue or cramping. Option D, no change in feedback. And the answer is option C, muscle fatigue or cramping. So let's start with the learning tip. Temperature is 52 to 57 degrees Celsius. Indications: rheumatoid arthritis, post-traumatic stiffness, scleroderma. Contraindications: open wound, impaired sensation, acute inflammation. Techniques: 6 to 10 dips, plastic wrap towel. This repeats 80% of paraffin wax questions across all exams. Let's move to question number 1. What is the recommended wax to oil ratio for paraffin bath in most clinical application? Option A 1:1, option B 4:1, option C 7:1, option D 10:1. And the answer is. Now let's move to question number 2. Which application technique is most suitable for treating larger flat areas like the back? Option A dip and wrap, option B brushing or painting, option C immersion, option D pouring. And the answer is option B brushing or painting. Now let's move to question number 3. What is the primary mechanism of pain relief in paraffin therapy? Option A gate control activation, option B increased collagen extensibility, option C reduced nerve conduction velocity, option D muscle spindle inhibition. And the answer is option A gate control activation. Now let's move to question number 4. Why is paraffin wax preferred over water-based heat packs for hand therapy? Option A higher specific heat capacity, option C conform better to joint contours, option C prevent skin maceration, option D deeper tissue penetration. And the answer is option C prevent skin maceration. Now let's move to question number 5. What is the core material inside hydrocollateral packs? Option A silicate gel, option B bentonite clay, option C paraffin wax, option D cellulose fibers. And the answer is option A silicate gel. Now let's move to question number 6. What is the maximum recommended treatment duration for hydrocollateral packs? Option A 10 to 15 minutes, option B 20 to 30 minutes, option C 45 to 60 minutes, option D 2 hours. And the answer is option B 20 to 30 minutes. Now let's move to question number 7. Which factor most affects heat transfer efficiency in hydrocollateral therapy? Option A pack temperature, option B towel thickness, option C body fat percentage, option D room humidity. And the answer is option B towel thickness. Now let's move to question number 8. What is the primary mechanism of heat transfer in infrared radiation therapy? Option A conduction, option B convection, option C radiation, option D evaporation. And the answer is option C radiation. Now let's move to question number 9. Which wavelength range is considered therapeutic for IRR in physiotherapy? Option A 100 to 400 nanometers, option B 700 to 1400 nanometers, option C 780 to 1500 nanometers, option D 3000 to 4000 nanometers. And the answer is option C 780 to 1500 nanometers. Now let's move to question number 10. Which type of IRR source emits the majority of its energy in A band? Option A non-luminous lamp, option B microwave generator, option C sunlight, option D luminous lamp. And the answer is option D luminous lamp. Now let's move to question number 11. Which law states that the intensity of radiation is inversely proportional to the square of the distance from the source? Option A Arnold-Klotz principle, option B Gottes-Dapper law, option C inverse square law, option D cosine law. And the answer is option C inverse square law. Now let's move to question number 12. What is the maximum penetration depth of IRR in skin for therapeutic A band? Option A 0.1 mm, option B 1 mm, option C 3 mm, option D 10 mm. And the answer is option C 3 mm. Now let's move to question number 13. Which tissue type absorbs the most heat during SWD using capacitive electrode? Option A bone, option B subcutaneous fat, option C muscle, option D cartilage. And the answer is option B subcutaneous fat. Now let's move to question number 14. What is the main difference between capacitive and inductive SWD electrode? Option A capacitive electrode use magnetic fields, inductive use electrical fields. Option B capacitive electrodes create stronger electrical field, inductive creates stronger magnetic field. Option C both use only electrical fields. Option D both use only magnetic fields. And the answer is capacitive electrode creates stronger electrical field. Inductive creates stronger magnetic field. Now let's move to question number 15. Which of the following is a thermal effect of SWD? Option A, decreased blood flow. Option B, decreased oxygenation. Option C, reduced cell metabolism. Option D, increased collagen extensibility. And the answer is option D, increased collagen extensibility. Now let's move to question number 16. Which tissue is least affected by SWD? Option A, muscle. Option B, fat. Option C, bone. Option D, cartilage. And the answer is option D, cartilage. Now let's move to question number 17. Which of the following is a non-thermal effect of SWD? Option A, increased microvascular circulation. Option B, decreased cell metabolism. Option C, reduced ATP synthesis. Option D, inhibition of phagocytosis. And the answer is option A, increased microvascular circulation. Now let's move to question number 18. What is the effective penetration depth of 2450 MHz microwave diathermy? Option A, 1 mm. Option B, 3 mm. Option C, 3 cm. Option D, 10 cm. And the answer is option C, 3 cm. Now let's move to question number 19. What is the main mechanism of heat production in tissues during SWD? Option A, conduction. Option B, friction from oscillating ions and dipoles. Option C, reflection at tissue interface. Option D, absorption by bone only. And the answer is option B, friction from oscillating ions and dipoles. Now let's move to question number 20. Which of the following is a contraindication for SWD? Option A, osteoarthritis. Option B, acute inflammation. Option C, chronic pain. Option D, muscle spasm. And the answer is option B, acute inflammation. So that's all for today. If you have any doubts, please do mention in the comment box. I have given the explanation inside Telegram channel also. Next video will be about clinical application on electrotherapy. And some evidence-based stuff are coming up. Wait till next week for the video. And all the best for your exams. And thank you.